Let's take a moment to consider sleeping arrangements for your little one. A look at sleeping close to your baby. It's a topic filled with varying opinions, cultural nuances, and personal preferences. Co-sleeping means sleeping near your infant. It's a broad term that encompasses various sleeping arrangements, all centered around keeping your baby close during the night. It's something practiced worldwide for generations. Across different cultures and throughout history, families have chosen to sleep in close proximity to their infants for a multitude of reasons, ranging from practicality to emotional bonding. It's not just one thing. Co-sleeping isn't a rigid practice with a single definition. It's a spectrum of choices. It includes room sharing. This is often the first step many parents take, keeping their baby nearby without sharing a sleep surface. Baby in the same room, separate sleep space. This could involve a bassinet, a crib, or a co-sleeper attached to the parent's bed, providing a dedicated space for the baby while maintaining close proximity. And bed sharing. This is where the baby shares the same sleep surface as one or both parents. Baby in the same bed. It's a practice that offers maximum closeness, but also requires the most careful consideration of safety guidelines. The American Academy of Pediatrics recommends room sharing for at least the first 6 months. This recommendation is based on research showing a reduced risk of sudden infant death syndrome, or SIDS. Room sharing keeps your baby close for feeding and comfort, making nighttime feedings easier and allowing you to quickly respond to your baby's needs, but on a safe, separate surface. This ensures that the baby has their own dedicated sleep environment, minimizing potential risks associated with bed sharing. Bed sharing is more controversial, with varying opinions among experts and parents alike, and requires careful attention to safety. If you choose to bed share, it's crucial to follow specific guidelines to minimize risks and create the safest possible environment for your baby. Many parents choose bed sharing for the closeness and connection, feeling that it strengthens the bond with their baby and promotes easier breastfeeding. But it's a personal decision, one that should be made after careful consideration of your individual circumstances, beliefs, and risk factors. Where your baby sleeps is tied to our instincts to protect and nurture. It's a deeply personal choice that reflects our desire to keep our little ones safe and secure. The discussion involves safety, culture, and family values, making it a complex and multifaceted topic. There's no single right answer. What works for one family may not work for another, and that's perfectly okay. My goal is to help you understand your options, providing you with the information you need to make an informed decision, so you can make the best choice for your family, a choice that aligns with your values, beliefs, and safety considerations. Let's explore what co-sleeping really means, delving into the different types and the potential benefits and risks, and how to do it safely, focusing on evidence-based guidelines and practical tips to create a secure sleep environment for your baby. Many parents, especially in those early, sleep-deprived days, find themselves co-sleeping almost by accident. It often starts with the best intentions, bringing the baby into bed for a quick feed or cuddle. Co-sleeping often starts because it makes nighttime parenting easier, offering a practical solution to the demands of a newborn. The convenience of having your baby close by can be a lifesaver when you're navigating those frequent night wakings. This is especially true for breastfeeding mothers, where the ease of nursing on demand throughout the night becomes a significant advantage. Nursing in bed means more sleep for both you and your baby. It minimizes disruption and allows you to respond quickly to your baby's needs without fully waking up. This can lead to longer stretches of sleep for everyone involved. The desire for closeness is powerful. It's a fundamental human need that extends beyond just practical considerations. Nighttime is a chance to reconnect and bond, offering a quiet and intimate space to nurture your relationship with your baby. It's a time when the world slows down and you can focus solely on each other. Babies are biologically wired to be near caregivers. It's an instinctual drive that ensures their survival and well-being. This proximity helps them feel secure and loved, providing a sense of safety and comfort that allows them to relax and thrive. Knowing a caregiver is nearby provides a sense of calm. Co-sleeping can lead to calmer, more content babies, as the constant reassurance of a parent's presence can significantly reduce anxiety and fussiness. These babies often sleep better and cry less, experiencing fewer disruptions throughout the night. This can translate to a more peaceful and restful experience for both baby and parents. Your presence helps regulate your baby's breathing, providing subtle cues and signals that promote healthy respiratory patterns. It also helps regulate their heart rate and temperature, ensuring they maintain a stable and comfortable physiological state throughout the night. Quick response to your baby's needs is easier and more efficient when they're within arm's reach. This proximity allows you to address their discomfort or hunger cues without delay, ensuring they feel safe and cared for. You can often soothe your baby before they fully wake or cry, preventing unnecessary distress and promoting a more peaceful sleep environment. This immediate care builds trust and security, fostering a strong and loving bond between you and your baby. It reinforces the message that you are always there to meet their needs. Many families find co-sleeping turns stressful nights, filled with constant wakings and anxieties, into peaceful, connected time where everyone can relax and enjoy a more restful sleep. It's about biology, comfort, the innate desire to be close to your child, and making life with a newborn a little easier, finding practical solutions that work for your family's unique needs. For some, it's the best way to get the rest everyone needs, allowing parents to recharge and be more present during the day. But every family is different, with varying needs, preferences, and circumstances. What matters is finding what works for you, making informed decisions that prioritize the safety, well-being, and happiness of your entire family. Let's look at the deeper benefits of sleeping close to your baby. Bed sharing can help breastfeeding mothers nurse more often and maintain milk supply. Nighttime nursing is about comfort and bonding, not just food. Co-sleeping creates a secure attachment, building your child's confidence and emotional health. Parents often feel more connected and confident, strengthening the family bond. Babies' immature systems benefit from your presence. Your breathing and warmth help regulate them. Many families report better, less fragmented sleep when co-sleeping. A simple touch or word can settle your baby quickly, leading to more restful nights. Well-rested families are happier and healthier. Co-sleeping, when done safely, can be a beautiful way to nurture your baby. Now, let's talk about the risks of bed sharing. The biggest concern is the increased risk of SIDS and accidental suffocation. Adult beds aren't designed for infants. Soft mattresses, pillows, and blankets can be dangerous. Parents who smoke, use alcohol, or take sedating medications should never bed share. Other children or pets in the bed increase risk. Babies should never be left alone on an adult bed. Understanding these risks is essential for making safe sleep choices. Co-sleeping isn't perfect for everyone. Some parents and babies sleep worse together. Babies can be restless, and parents may wake at every sound. The goal is restful sleep for all, so room sharing with separate surfaces may work better for some. Co-sleeping can affect couples' intimacy and privacy. It's important to communicate and find ways to nurture your relationship. Transitioning a child to their own bed later can be challenging and emotional. Some parents feel touched out and need space to recharge. Your needs matter too. Choose what helps your family thrive. If co-sleeping causes stress, it's okay to try other options. If you choose bed sharing, safety is non-negotiable. Follow the Safe Sleep 7. No smoking, ever. Be sober and unimpaired. No alcohol, drugs, or sedating medications. Bed sharing is safest for breastfeeding mothers, who naturally sleep protectively. Your baby should be healthy and full-term. Always place your baby on their back to sleep. Use a firm, flat mattress. No soft bedding, pillows, or toys. Never bed share on sofas, recliners, or waterbeds. Only the mother and baby should share the bed. No other children or pets. If you can't meet all these conditions, use a separate sleep space. These rules greatly reduce risk and help keep your baby safe. Safety always comes first. Beyond the basics, here's how to make your sleep space safer. Use a firm, flat mattress, no memory foam or pillow tops. Make sure the mattress fits snugly with no gaps. Keep bedding simple, no pillows or heavy blankets near the baby. Dress your baby in a sleep sack or wearable blanket for warmth. Keep the room cool and dress your baby lightly. Place your baby next to the mother, not between two adults or on the bed's edge. Remove all stuffed animals and decorative pillows. If your partner is a deep sleeper, consider a co-sleeper cot. Simplicity and vigilance are key to safe co-sleeping. Always check your setup for hazards. When it's time to move your child to their own bed, it can feel like a monumental change for everyone involved. It's a significant milestone, marking a step towards greater independence for your little one. Make it gradual and loving. Approach the transition with sensitivity and understanding, creating a positive and reassuring experience. Remember, this is a process, not an event. Start by making the new sleep space fun and inviting during the day. Let your child explore their new room, play games, and create positive associations with the space. Let your child pick out special bedding, perhaps featuring their favorite characters or colors, or a stuffed animal for their new bed. This can become a comforting companion during the night. Begin with the new bed next to yours, allowing your child to feel close and secure. This proximity can ease anxiety and make the transition less daunting. Lying with your child until they fall asleep. This provides reassurance and helps them associate the new bed with comfort and safety. Comfort them in their own bed if they wake at night. Gently reassure them that you're there and that they are safe. Gradually move their bed farther away, inching it towards its final destination in their own room, then into their own room. Maintain a consistent bedtime routine to provide a sense of familiarity and predictability. Stay with them until they're drowsy, offering quiet conversation or reading a story. Then leave. Let them know you're nearby and will check on them. Always respond with reassurance if they call for you. A gentle touch, a soft word, or a brief cuddle can make all the difference. Some nights will be harder than others. Be patient. There might be tears, resistance, or setbacks. This is a big step for your child. Acknowledge their feelings and celebrate their progress, no matter how small. A slow, gentle transition builds confidence and security. It fosters a sense of accomplishment and independence in your child. You're helping your child learn independence with love and creating a positive sleep experience for everyone. Where your baby sleeps is a personal decision. There's no universal answer. Trust your instincts and do what feels right for your family. The goal is a secure, loving bond, not just getting through the night. Be responsive to your baby's needs, whatever sleep arrangement you choose. The emotional connection matters more than the physical location. Stay informed about benefits and risks, and talk openly with your partner. Be flexible. What works now may change as your baby grows. Don't be afraid to try new approaches if needed. Support other parents and avoid judgment. Every family is doing their best. Trust yourself. You know your baby best. You're doing a wonderful job.